On the chalkboard over there are batteries, chalk, and an earring.
Okay, well, obviously.
It's not mine, no.
I think we're going to start.
Okay, that's fine.
Good morning, everybody. Welcome to Grand Rounds. It's a real pleasure today to introduce Dr. Robert Keys. You can see his credentials. Bob and I go back many, many years. I hadn't realized that this was a great passion. I've just been sitting here listening. The music and medicine were a passion. We've seen him perform in medicine, and passionately is the way I would describe it, and involved. And now we're going to hear the combination of medicine and music.
Great, thanks. If you want to come closer, you can, or if you're comfortable where you are, you can stay where you are. The way this presentation is working, as you can see, it's part 2. It's actually, I have 3 sections. So I chose part 2 today because some of my favorite composers are actually in this particular section. What I intend to do is present this, and in the background, as I'm talking, you'll hear representative pieces of music from the various composers that I'm talking about. The volume varies from section to section, so I may have to immediately put it up or put it down. Are you happier with that? Okay. So first of all, this is who I am, in case you don't know who I am. The younger members of the Department of Medicine probably don't know who I am, except if you read any EEG reports, you'll find that my name is very commonly attached to the EEG reports. That's where I hide out in the hospital now. So this is my musical background. I have grade 10 piano conservatory. Anybody that knows anything about music knows that it's actually a fairly significant accomplishment to get to that particular level in piano training. I also have grade 8 Toronto Conservatory voice, which is almost as good, but not quite. I've had voice training for about 25 years, and I continue to take voice lessons on a regular weekly basis. And I have a reasonable amount of choral experience in Vancouver. I used to sing with the Bach choir, but as I was saying earlier, I got tired of singing giant symphonic works. So now I sing with Encore, which is a mixed voice audition choir for mature singers, not senior singers, mature singers. And in that particular choir, there are about 55 to 60 people. And the total accumulated musical experience, if you add everybody's experience, that's probably about 2,500 years of musical experience. And in the last 5 or 6 years, I've also joined Corleone Men's Choir, which is probably one of Canada's, if not North America's, most recognized, and if I do say so myself, best men's choirs. And as I was saying earlier, Corleone has recently been nominated for a Juno Award in the Best Classical Album category. In the background, while I'm talking, and have been talking, what you hear is a recording made by Encore a couple of years ago for CBC when we did a presentation at Festival 500 in Newfoundland. With that long introduction, whether we're talking about neurological musicology or musical neurology, it doesn't really matter. It depends on who I'm giving the presentation to. And these are the eras that I'm going to be talking about, and I've picked representative composers from each of these particular eras. For me personally, I think that once we get past the Baroque era of about 1750, everything else is modern, and it's not really my favorite. So I really like medieval, Renaissance, and Baroque music, and that's where I feel the most comfortable, and that's what I usually sing. It's not what the choirs sing, but it's what I sing. So anything that's medieval or early music is before 1400. Can you hear the music in the background? Okay. So who I'm going to talk about is this lady, Hildegard von Bingen. You may or may not have heard of her. She was a very famous abbess in Germany, and she was not only remarkable from the point of view of her musical abilities, because she wrote music, and this is one of the pieces that's going on in the background, but she wrote a lot of early works regarding natural pharmacology and the use of plants in the treatment of a number of diseases. She was extremely sought after in this particular time because of her abilities to treat diseases that nobody else could treat. I just threw this picture in because I like it, and it's actually one of the rose windows from Notre Dame Cathedral. And as you know, that cathedral suffered a horrible fire a couple of years ago, and all three of these rose windows, which if you've never seen them, are absolutely unbelievable, and they're huge, and they've survived the fire, which was amazing. So Hildegard was the youngest of 10 children. As you can see, she was a philosopher, a writer, a mystic, and a visionary. She was ultimately made a saint by one of the popes, I don't remember which one, hundreds of years after her death, because that's what happens. She's the founder of the German scientific natural history. As I said, she was a herbalist, and she wrote two major works, which I've outlined here. And there's the Pope, Benedict, with more than 100, a little longer than 100 years later, it's like 1,000. She composed numerous different compositions, and what you hear in the background is some of her music. And for those of you who don't know anything about music, then one of the things that she did that was different than the long-standing Gregorian chant is that she took the Gregorian chant and turned it into all these melodies that you can hear in the background. And the term melisma, from the musical point of view, refers to the fact that there's about 1 billion notes for one syllable of word. So there's all sorts of these melodies going, and there may only be 1 or 2 syllables associated with the music. Now, in terms of her neurological history, and lots of people have investigated her from the historical point of view, she began to have what were called visions when she was the age of 5. And she was said to be very sickly. It was felt that her symptoms may well have been related to migraine. And what you see here is what they used to treat migraine with. They made it into a flower and plopped it on the head. And that was supposed to be helpful in terms of migraine headache treatment. Not too unusual. I mean, today people put various cold or warm cloths on their foreheads or on the back of their head or whatever. So that's not too much different. I don't think many people make bread and throw it on top of their heads anymore, but that's what they did at that time. In her visions and in her writings, she described a whole series of various things, as you can see up on the board here. And in point of fact, if you look at it from our perspective in the 21st century, then you would say, well, this lady probably had migraine headaches. That would be your first diagnosis. Now, you have to remember that she's living in 1100, and she's an abbess, and she saw all these things, and of course, she was communicating with God, and that's why she had all these visions. These are two representative pictures of her that are obviously from the 11th or 12th century, and I say obviously because they're really two-dimensional and it's not three-dimensional in their appearance. The one on the right is meant to represent the orange things that are sort of sticking out of her head, are meant to represent her connection with God and that she's receiving messages from God, and that's why she's having these particular visions. So various people, including Oliver Sacks of Awakening fame, have studied her works and have studied her described symptoms, and basically concluded that in all probability what she was experiencing was a combination of common migraine headaches, classic migraine headaches, and maybe even complicated migraine headaches, depending on the various symptoms that you see described with her. So, as you can see, that was what was felt to be the cause of her symptoms, and she lived surprisingly long. She lived to be in her early to mid-80s, and when you consider that in the 1100s, the average lifespan of an adult, male or female, was about 20 to 25 years of age. So I guess it points to the fact that if you live isolated in an abbey, you might have a better chance of surviving all the bad things that go on in life. So now we're going to move on to the Renaissance period, which is getting into one of my more favorite eras of music. I picked this fellow, and you may not have heard of him. A lot of people haven't. He was actually a very interesting man from the musical point of view, and he was very forward-thinking in terms of the type of music that he wrote. He also was a horrible person. He was a very evil man, and he did some very horrible things in his life. That's not why I picked him, but it was interesting to read about him. First was an earlier picture. This is a later picture of him. And this is a picture of Venus. It's a painting of Botticelli, by Botticelli, who was painting at the same time as Gesualdo was around. So he originated in Naples, in southern Italy. He had a lot of connections with the Catholic Church by virtue of family, but that's not unusual because just about everybody that was in the nobility in Italy in those particular days was related to something to do with the church, usually the hierarchy. He had planned to become an archbishop or cardinal or something, but unfortunately his older brother died, which he considered very unfortunate because it forced him to become the prince of the area, which he really didn't want to do. He was very talented from the musical point of view. He played a number of musical instruments. He wrote many different pieces, and as you can see, he composed different types of music, usually vocal, some instrumental. Based on his personality and what you may or may not know about musical composition in the Renaissance and Baroque eras, there were very strict rules about what you could and couldn't write and how you could write them. And this particular fellow decided that he wasn't going to pay attention to the rules and wrote his own music, and many of the things that he wrote were duplicated several hundred years later. Most of his trouble began in 1590, as you can see here. He was probably in his mid-20s at that particular point in time, and he found his first wife and her lover in their bed, and he went completely berserk and murdered them both, and in a not very pleasant way. Suffice it to say, the two murdered individuals ended up in bits. That's sort of what happened. After that, this man became increasingly more bizarre in his behaviors, and he developed a rather prolonged depression. He also, over the subsequent 5 to 10 years, had a whole host of presumably recriminating thoughts about what he had done. And in order to assuage his guilt, he hired one or two individuals who would regularly come in about once a week and beat him up. And he was also prone to self-mutilation, all of which occurred at the same time as he was writing all of this unbelievably exquisite music. And as you can see, he got progressively more bizarre in his behaviors, and as he went through his life, the frequency and the numbers and severity of beatings that he brought on himself increased, and ultimately he died from multiple trauma. And in all probability, this particular composer had probably an initial psychiatric disorder, probably a paranoia, whether it was a bipolar or schizoaffective disorder, I'm not sure, and I don't think anybody really knows. And then the murders of his wife and her lover occurred, and subsequent to that, as I said, he was repeatedly beaten up, and not surprisingly, I'm sure he sustained repeated multiple traumatic brain injuries, which just further aggravated his behaviors, and ultimately, as I said, that was the cause of his death. So, so you have this fellow who, if you've been listening to the music in the background, and if you were listening to that and not listening to me, I don't mind, because the music is actually very nice to listen to. But this particular individual was so horrible, and his life has been recently re-examined, and there have been a number of books recently written on this particular individual, even a play. And I think that, like anything else, it's unfortunate that this particular series of events occurred. So I'm going to move on to my absolutely favorite musical era, which is the Baroque era. And what you hear here in the background, and the composer that I'm going to talk about in a moment, is Handel, who also happens to be my favorite composer within the Baroque era. And the piece that you hear in the background is, I chose it because it's one of Handel's pieces, and it actually represents one of the two voice ranges that I sing. This particular voice range and is sung by an individual who's called a countertenor, which actually equals male alto. And that's the voice part that I sing when I'm singing with Corleone Men's Choir, because I sing at the top of the men's range, obviously, as you can hear. And the other voice range that I sing in is standard upper tenor range. So it's not really a whole lot of difference, but this is just one of them. So Handel is a very interesting fellow, and he was a very prolific composer. Most of you know him probably from The Messiah, and which is probably his single most recognizable and famous piece. This is a picture of the original or old Naval Academy in London, and I put it in here because it was designed and built by Sir Christopher Wren, who is the same architect who built St. Paul's Cathedral in London. And Handel and Wren were coexisting in London at about the same time. Handel, as you may or may not know, was originally from Germany, And then when the German royal family was moved over to become the British royal family, then he sort of followed along and went with them. He was a very intelligent person. He spoke multiple languages. He played keyboard instruments extremely well, and he was a very great composer with respect to vocal composition. And from Handel's medical history, as you can see, many members of his family all died relatively young from a series of strokes. That picture that I showed you of Handel was in his early adult years. The later pictures that you see of Handel, he gets bigger and bigger and bigger in body size. He was very large, not as large as Orson Welles, perhaps, but just very large. So he had a number of risk factors for a stroke, not only family history, but he also smoked, he was obese, he loved everything that was loaded with fat and goop, and not surprisingly, he ultimately probably developed a series of strokes. He had an episode at age 52 where he had paralysis and abnormal speech with a 6-month recovery. At the age of 58, he had another episode also related to weakness and speech problems. At age 60, he started to develop difficulties with his memory, and at age 65, he had transient loss of vision in his left eye. And he had a second episode of transient loss of vision in his left eye and an inability to write or play the piano at that time. At age 66, he had permanent loss of vision in his left eye, but he was still able to go back to composing music. And at age 68, he developed problems with his right eye. And at that time, they thought he probably had a cataract. So he had an operation on his right eye, and I can't imagine in the 1700s what a cataract operation would be like. It would have been grotesque, is all I can say. In any event, it wasn't successful because it wasn't, of course, the cause of his visual symptomatology. His neurological diagnoses undoubtedly represented a combination of small and large vessel cerebral vascular disease. He probably had a left carotid artery stenosis with amaurosis fugax. Hopefully you were thinking along those lines as the history was evolving. He likely had central artery occlusion and ischemic optic neuropathy, especially on the left. He probably also had right carotid artery disease with recurrent amaurosis on the right side, and probably also ischemic optic neuropathy for the same reasons. And his overall cognitive function was the combination of multiple large and small vessel infarcts with a multi-infarct dementia. So this is the next musical era, which is becoming closer and closer to where we are now. As I said earlier, for those who walked in a little later, from this point on, as far as I'm personally concerned, everything is modern music. It's not really, but that's what I think. So I'm going to talk to you about Haydn. Haydn was probably one of the most successful composers in the Baroque classical period. He was actually able to make a living throughout most of his life from composing, which was an unusual thing to do, because most composers in those eras died when they were in their 30s or 40s in abject poverty. However, he lived very well, and he composed multiple different pieces in multiple different genres. This is a painting by John Turner, who is an English artist at the same time. And Haydn was Austro-Hungarian. Like many of the composers at that time, they were musical prodigies, and he was as well. He played violin and harpsichord, and he joined the cathedral choir because that's what you did. If you came from a well-to-do family and you had any kind of musical ability, you joined the cathedral choir, and that's how you got a lot of your musical training. I don't know whether you can hear that. That's better. And as you can see, as he became an adult, he married, hated his wife, didn't spend any time with her if he could avoid it, and traveled all over Europe, spending many years in different locations, composing different types of musical compositions. Needless to say, he didn't have any children. I think the reasons for that are probably obvious. Esterházy was an Austrian noble family, and they were his supporters, and they paid him very handsomely. And he went to London in the late 1700s, in the 1790s, and that's when he wrote many of his most successful symphonies. In fact, his entire life, he probably wrote 105, if I remember correctly, symphonies in addition to everything else. However, by the time he was in his later years, he had decreasing work output. He had increasing difficulties with memory, had to be reminded about what to do. He would often laugh inappropriately at the absolutely wrong time. In 1803 was the last time that he actually conducted any of his own musical compositions. He got progressively more dizzy, progressively more unsteady. He had slow and stiff movements. He had difficulties with handwriting, and he had spontaneous tearfulness. I wonder what symptom that represents. Probably pseudobulbar affect. At his last public appearance in the early 1800s, he had to be carried in by a chair, or on a chair. And in 1809, he complained of a severe headache and died. Probably had an intracerebral hemorrhage at that point. So this, in the background, by the way, is, for those of you who don't know anything about music, you can tell it's a trumpet, and it's the Haydn Trumpet Concerto, which is one of the major works that anybody that plays trumpet will perform. So Haydn had vascular encephalopathy with multiple small infarcts. He had diffuse atherosclerotic disease, and he also had congestive heart failure, based on other things that I didn't present at this point. So I'm moving into the classical period, and you can tell me whether you think this piece belongs to the composer that I'm going to present. This is a trick. This is who I'm going to talk about, but this is not the music of this particular composer. Yeah, who is the composer of what's going on in the background? Yes, you're correct. Elvira Madigan. You're right. That's correct. It's actually the second movement. It's the easiest one to play. Oh, sorry. The music that you're hearing in the background is by Mozart. It's not by Schubert, who I'm going to talk about. And the piece is a Mozart piano concerto that was used in the background of the movie Elvira Madigan long before many people were alive in this room. There are a few of us Dr. Casson and I have talked about how we've been around since the Jurassic period, so we're familiar with that. But this is not by Schubert. I threw that in because I just threw it in. So I'm going to talk to you about Schubert. And this is one of the musical pieces by Schubert many years ago, like many decades ago, I guess, in a different century. I used to be able to play this, not anymore. My fingers don't work like that any longer. So, poor Schubert. First of all, the problems began because he was the fourth son. In those particular eras, the further down you were in the birth order, the worse off you were. If you were number one, then number one sort of got everything, and then it kind of petered out after that. Anyway, he played piano and violin. His saving grace was that because of his talent, he was able to get a scholarship to the Austrian imperial court, meaning to the royal family in Austria. And he learned musical composition from Antonio Salieri. Now, if any of you have seen the movie about Mozart that was done about maybe 15 years ago, and they portrayed Salieri as a complete, not boob exactly, but he was a very difficult man, and he and Mozart did not see eye to eye because Mozart superseded him in the eyes of the Emperor of Austria. But anyway, Schubert learned his composition from that particular individual, which shows you how interrelated all of these famous musical people were, whether they were performers or, in this case, whether they were composers. So he wrote a whole host of compositions. Many of them weren't very well received because they weren't in the strict classical style. In 1822, he began to become ill, and his health slowly deteriorated until he died in 1828. He was only in his early 30s when he died. And as you can see, he was considered the last classical composer and the first of the Romantic era, which I'll talk about in a moment. And in 1822, he developed a skin infection. It was a widespread skin infection, and they thought it was some sort of irritation to something he'd been exposed to. His mood changed. He became depressed. He became housebound. And he developed migratory, sharp stabbing and lancinating pains that involved his entire body, basically, face, torso, arms, legs. In 1823, he had a transient improvement in his health, and he started to compose again. His pains returned later in that same year of 1823. Then he developed a papular skin rash with scabs involving his face and his scalp. I hope people are getting the idea of what disease he might have. It is an infectious disease. And then he got severe pain in his left arm, and he couldn't play the piano, and he got more depressed. He received mercury treatment. That should be a big clue as to what his disease was. He couldn't basically sing. He couldn't play the piano. He really couldn't do anything, and was housebound for the last couple of years of his life. He got progressively weaker. He was unable to stand, and he became ultimately delusional and hallucinated in the days prior to his death. Almost certainly this fellow had syphilis, and specifically meningovascular syphilis, which would explain the symptoms that he had. And many people, composers, singers, artists of various types, authors as well as general public developed syphilis because of the life expectancy in those particular days. Most patients who developed primary syphilis didn't get to the stage of tertiary syphilis, of which neurosyphilis is one example. And the treatment at that time was to administer mercury, which probably does something in terms of preventing the multiplication of the spirochete. But the safety window of mercury is probably 0, and some of his neurological symptoms may well have been secondary to the mercury treatment that he received. Now, this is the last composer that I'm going to talk about, I think, and this is in the Romantic period. Yeah. Did you hear that? He wanted to remind people that an evening with Venus results in a lifetime with Mercury. So if you had to pick a composer or a country from, what country would you pick this composer coming from? No. No. Anybody else? What? Russia. Perfect. That's absolutely correct. Doesn't that sound Russian to you? You know? Anyway, this fellow that I'm talking to you about is named Mussorgsky. He was actually quite a prolific composer until he became very friendly with the bottle. And that's what he looked like prior to his death. Just to remind you, that was early in his life. This was after a number of years of many bottles per day. And we're all aware of what alcohol does to you. And it's amazing that we have paintings. This is a painting of him. So at least he was able to sit long enough to have the picture painted. Anyway, he was supposed to go into the military. He didn't like it, so he resigned, which was a bad thing for him to do because that was going to provide him with income. And what you hear in the background is probably his most famous composition called Pictures at an Exhibition. He played all sorts of piano pieces. He was a piano prodigy, actually, in his childhood. And there were, as you can see there, the list of the 5 composers, Russian composers of the same era, who were known as the Mighty Handful. One way or another, they all came from upper middle class or upper class families. This is one of the parts of Pictures at an Exhibition. And those are his 3 most famous compositions. Unfortunately, he didn't live long enough to produce more work. He had a history of depression and probably had a depressive mood disorder. That's probably in part what led to the excessive use of alcohol throughout his life. And all of the things that we know that go on with alcohol and other substance overuse that we see on a daily basis here at St. Paul's Hospital are all applicable to Mussorgsky, 150 years ago or so. He never married. He spent most of his time alone, and his bottle was his friend. As you can see, his facial appearance gradually changed over his life, consistent with the effects of chronic alcohol overuse. And ultimately, beginning about 1875, when he was in his 40s or so, his musical output gradually fell off, and ultimately he left a number of incomplete pieces just because of that. He continued to consume large amounts of alcohol throughout his entire life, he was admitted to hospital, presumably in varying stages of alcohol withdrawal or alcohol excess or a combination thereof, and all the things that we know about in terms of alcohol overuse effects of long-standing, both acute and chronic nature. When he was in the hospital, of course, he improved. That sounds very similar to patients that come into this particular institution for a period of time. They get better, and then they go back out, and things go back to the way they were before. So it's felt, based on a review of his life history, that he had again, a significant underlying neuropsychiatric disorder complicated by chronic alcohol overuse, and he had a number of complications, both neurological and non-neurological, related to his alcohol overuse. So he also, as you can see, got bloated, and he was very swollen, so he probably had alcoholic cardiomyopathy. He undoubtedly had some degree of peripheral neuropathy because his balance was severely affected, and he had to be helped when he was walking. And he likely developed Wernicke-Korsakoff syndrome prior to his death. So, in summary, by the way, while I'm summarizing, in the background you will hear music sung by Corleone, which is one of the choirs that I sing with. So, as you can see, I presented those 6 composers. They all probably had some degree of neurological difficulty of one form or another. And they ranged through something as relatively benign as migraine headache with aura to neurosyphilis, different manifestations of atherosclerotic vascular disease and cerebral vascular disease in particular, to alcohol and its effect on the brain. So here's a picture of, I don't know if there's a pointer. Use the mouse. Is it up there? Maybe I can do this. You see there? Far right. Anyway, that's me on the far right at the back in Encore. And here's a picture of Corleone. And you can tell that's taken at Jericho Beach. We're all in tux and tails. And for those of you who have never worn tux or tails, I will just tell you that the pants and the coat are heavy wool, and with a vest and a pleated shirt. And this picture was taken in July when the temperature outside was like 35 degrees. I'm at the back. I'm right on the far side over there, at the very back row, second from the in there. And I'm not standing on the ground and everybody else is standing on a rock. That just shows you that some of the people in our choir are very tall. So that is it. I hope you learned something this afternoon. I realize that it isn't necessarily about the latest treatment of cardiomyopathy or whatever. But obviously one of my big interests, as you can tell, is music and musical history and neurological history. So thank you very much for listening.
Do you have any theories about why the first composer didn't maybe hit the 80s, but the rest seem to have had lives that weren't as stellar in some aspects as
Well, so Hildegard von Bingen, who is the first composer, she basically went from her family. She was the youngest, or one of the youngest of 10 children, and born to a Catholic family. And in those days, numbers of male and female children were committed to the Catholic Church. So she was basically sent to the nunnery when she was very young, and she spent her whole life within the confines of an abbey. And presumably, therefore, she wasn't exposed to the disease processes that were sailing around outside. Presumably, also, she had a less stressful life. Maybe she wasn't in conflict and didn't mind being in a convent. And then, of course, there's always genetics. So that's her. All the other composers, Handel lived to be in his 60s, and his life was in the late 1600s to the early to mid 1700s. And to live to be, you know, mid 60s in those particular years was actually a relatively good lifespan. And probably if he did what we did now and ate carrots and took statins, he probably would have lived longer. The other composers, Mussorgsky died because he basically had a mood disorder that was very severe and got into alcohol at a very young age and then spent his whole life consuming alcohol. Schubert died because he got neurosyphilis. There are lots of composers that got neurosyphilis. And if they didn't get neurosyphilis in the sort of classical and romantic era, then they usually died young of TB. So most of those composers died either from substance use, presumably alcohol, or mostly alcohol, or they developed a infectious disease of one form or other. You're welcome. Oh, good. I'm glad you liked it.
absolutely
Totally different than the average medicine. Good. That's me. Count on something different.
Yeah. No, I think that was
Thank you for coming, Alistair. I did. Good. Good.
Linda Ronstadt. Linda Ronstadt
Yes.
has progressive supranuclear palsy.
I know. It's awful.
Trying to think of famous musicians like John Lennon had lead poisoning.
Yes.
It's a bad choice.
Yeah.
Trying to think of neurological diseases or contemporary musicians.
Yeah. There are. Yeah. Good. I'm glad you enjoyed it. Yes, Linda Ronstadt has.
Which is such a rare disease.
It's a rare disease and a very awful disease.
Awareness of PSP will be because she has it. Will be up.
Yes. It was really. I hadn't seen pictures of her forever, and then of course in the last few months to a year, and then it's pretty sad. Yeah, nice to see you. Oh, good. I'm glad you enjoyed it. Nice to see you. You're doing well?
Yeah.
Good. So am I. I'm still here, doing my thing. Yeah.
I'm curious about your thoughts on people who see music. I don't know the term for it. People who see that music is actually a visual experience for them.
Yes. And
I
they,
don't know the term
know
for
the
it.
term.
I've forgotten the term. I've forgotten the
My
term.
daughter got fascinated by it a few years ago.
I find it fascinating that people can
Well, it's
see music.
yeah, and here I just about to say colors as well, and presumably the reason is that in those particular individuals, the auditory cortex and the visual cortex have a connection, an interaction that doesn't take place in the normal brain. And so that when they hear, like, Elvira Madigan, then what they're seeing is whatever they see. But that's because the music is being, at the same time as they hear it, and you're stimulating the visual cortex. Most of the time in those situations that I've read about, because I've never seen a patient with that, most of the time those particular individuals tend to have like unformed visual things. In other words, they're seeing colors and unformed objects, as opposed to hearing a piece of music and suddenly seeing a tree or a dog or that sort of thing. So I think that's how it works, at least anatomically and physiologically. That's what I would think, but I don't think anybody has been able to prove that.
I'm really fascinated how you like this.
How I like it?
Yeah, I can't hear, I mean, this is just me being a music luddite, but I mean,
Yeah.
I can't, no, but I'm just saying, how you just differentiate the different types. You can hear things that I'm not hearing, because it sounded very much
I know.
the same to me.
Yeah.
I mean, not some of it, but most of the early, and I mean,
Yeah.
it didn't sound different.
Well, some of it is, in fact, learned. Some of it is related to your exposure to the music, and then your understanding of the various musical eras. It's very similar to, not only does music follow those eras, but also architecture and painting, etc. And just as there were rules for musical composition, there were rules for building buildings, there were rules for what you could do in a painting. And once you have been exposed to any of those types of things, then it's pattern recognition.
But you can hear, I'm sure, the different instruments, the different.
Yeah.
I know. I mean,
You're a medical. You're a diagnostic expert. You're things that you've done for it. You can do.
I recognize it, but it's just. I mean, I know that you can separate all those things. You can hear, and I know you learn these things. It's just that I'm just giving you the impression. To me,
it all sounded the same. No, I know, and I understand that. And
I mean, that's not to take away from what I admire things. I wanted to be the first woman. I didn't want to be those other guys.
You didn't want to be Gasuelo?
I didn't want to be
Gesualdo.
Gasualdo?
Yeah.
Oh.
Thank you very much. You're welcome.
Thank you. That was really,
Good.
really fascinating.
The first time I ever heard of pictures at an exhibition, it was a title of an Emerson, Lake and Palmer album.
Yes, that's right.
That?
Yeah, I remember that. That's right, exactly.
I have so much shit rolling around, and I'm sure you do too.
I know.
So much stuff rolling around in my brain.
And it's amazing how